It's important to understand that the IT band is fascia. It is not a muscle, which means it does not like to stretch. Fascia, when you apply tension to it, actually tears, which causes microtrauma, which increases the problem in the first place, and is why foam roller stretching is actually making your symptoms worse. I'm Dr. Amy, and we are empowering women with changing bodies to move pain-free. I also hold a PhD in orthopedic manual physical therapy and believe that movement is life, and you deserve both. Today, we're talking about the IT band, including what it is, what you should do if you have a problem in your IT band, and what you should not do if you have a problem in your IT band. The IT band runs down the side of your thigh, so from your hip to your knee. Now, in all truth, there is a portion of fascia that runs also from your knee to your foot on the outside. This is technically not called IT band, but if you feel like you have symptoms all the way from your hip to your foot, you're still in the right place. The IT band is made of fascia, which means it is not meant to stretch. If you're not familiar with fascia, think of a raw steak. If you try to pull the fat off of the meat and there's that white, really thick substance in between that makes it difficult to separate the two, that's fascia. And if you've ever tried to do that, you know how tough fascia can be to deal with. I mean, even if you try to use a knife on a raw steak, it is really difficult to separate the fat from the meat. So because it's fascia and not a muscle, it actually creates microtrauma when you apply tension to it. And microtrauma leads the body to create a healing response, which is scar tissue, leaving your IT band actually weaker than it was before. Also, remember that microtrauma leads to more scar tissue, which leads to more tension. But what is causing the IT band to feel tight in the first place? Well, you see, it's compensating for something else in the body. The most common culprits are different muscles that are up in the hip, including the gluteus medius, which is on the side of the hip, and the TFL, which is in the front of the hip, and the rectus femoris, which is part of the quadricep muscles or in the front of the thigh. The IT band attaches into all of these muscles. So if these muscles are weak, the IT band will become tight to compensate for them. Also, if the muscles become tight, then the IT band will be stretched, which will also cause tension. Now here's the crazy thing. If your pelvis is out of alignment, that means the muscles may be stretched or compressed, and that can cause the IT band to have to stretch as well. So when I say that IT band tightness is a symptom and not a cause, this is what I'm talking about. There's something going on, either a muscle that is weak or a muscle that is tight or a pelvis that is out of alignment that is actually causing this IT band problem, which leads to the things that we don't want to be doing. We don't want to be foam rolling the IT band. We also don't want to be smashing it with a lacrosse ball, and we definitely don't want to be aggressively stretching it. All of these things will cause that microtrauma, will increase the inflammation, and fascia does not have great blood supply, so it's going to lead to scar tissue and more pain and tension over time. I've convinced you to put the foam roller down. Now you want to know, what should I do instead? Well, the first thing we want to do is activate the gluteus medius muscles. So these are exercises like clamshell exercises or laying on your side and kicking your leg up to the side. I like to call them my Jane Fonda exercises for those of us who are a little bit older. But really, it's trying to get that gluteus medius, or that muscle that's on the side of your hip, to activate and get stronger. The next thing we want to do is lengthen the rectus femoris and the TFL. Now, it's hard to find stretches for these particular muscles, but what I would recommend is your favorite psoas stretch, because these muscles are also hip flexors. So if you're stretching your psoas, which is the biggest hip flexor, you're also going to be stretching the rectus femoris and the TFL. And the next thing you want to do is to check your pelvic alignment. If it's off, everything else is going to be off too. Now, this can seem a little bit weird, but I promise you, you can do this at home. What I want you to do is stand in front of a mirror, and you're going to put your hands on top of your hip bones, and you're going to put them straight forward. So you're going to put your hands on your hip bones, pointing forward, and then you're going to look at them in the mirror and see if they're pointing exactly the same way. If your pelvis is off, what will happen is that they will point in different directions, and usually it's pretty clear to the visible eye that there's something off about your pelvic alignment. Another thing, if you feel like your pelvis might be off, but you're having a hard time checking it, when you're walking, do you feel like one leg is shorter than the other? A lot of people who have a pelvic imbalance feel like one leg is shorter than the other, or they're constantly falling off while they're walking. This may indicate a pelvic malalignment as well. Now, I do understand that these things can be difficult to assess and check on yourself. So if you feel like you're having a difficult time understanding this, I'm going to recommend that you seek help from a manual physical therapist who can assess your pelvic alignment, who can do some muscle strength testing, and who can give you those exercises that'll be best for your body. Because IT band tension is a symptom of a dysfunction. It's not something that needs to be fixed by pressing on it or pushing on it with things like a foam roller or a racquetball. It's important to work smarter and not harder. So figuring out the root cause of your IT band tension and then treating that will naturally help to decrease the IT band tension over time. Because addressing the root cause means lasting relief. There are a ton of videos on YouTube that explain how you should be stretching your IT band, or how to use a foam roller for your IT band, or even how to use a racquetball on your IT band. And you may feel like I am saying something different than literally everybody else on YouTube, and I admit that I am. However, if that's you, I have a question for you. If you've been foam rolling or racquetballing or stretching your IT band, why are you watching this video now? You have not found the results that you are looking for thus far. So how about giving these tips a try for 2 to 4 weeks, and then drop me a comment down below and tell me how they're working for you. If you found this video to be super controversial, please give me a like so we can spread this controversy all across YouTube. And if you want more science-backed research physical therapy tips, go ahead and subscribe. And if you're wondering if your lateral thigh pain is actually an IT band issue or not, I'm going to have you go check out this video over here.